Have you been told that you have weak glutes that's causing your low back pain? But no matter how hard you work your gluteal muscles, that back pain is still there every day when you sit on your bottom. Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you 3 possible causes for your low back pain that's not just about weak glutes. So here at My Favourite Physio, we see lots of patients who come in complaining of lower back pain that sits just there where their tailbone is and into their buttock muscles and right into your butt cheeks, where every time you sit down, you feel this sharp pain poking right into your buttocks. So if you're out there and you identify with number 1, pain in your lower back that often is worse with sitting, and you feel you need to stand up to relieve that pain in your lower back and buttock area. Number 2, if you find that that pain is so persistent and no matter how much foam rolling you are doing to work it out into that area, and it still hurts because you can't seem to get it right into that spot of pain which you seem to feel so easily every time you sit down. And number 3, if you find that that pain seems to just come and go, sometimes it feels like it's okay because you're doing your exercises, but the minute you stop doing your exercises for one day, that pain is there, and sometimes that pain in that lower back catches you. Every time you stand up from a chair, you literally feel like you're going to collapse because it's a sharp stabbing pain right around that tailbone in your buttock region. So if you are saying yes, yes, yes to those 3 types of symptoms, then this could possibly be what's happening for your lower back. It's not just weak gluteal muscles. The solution is not just doing more exercises to strengthen your gluteal or buttock muscles, but in reality, there's probably deep muscle tightness that's not being addressed. And the more exercises you do, the tighter and deeper that pain becomes that you just can't seem to get rid of unless someone actually has a full assessment of your lower back and has a feel of those muscles. So what we find here commonly at My Favourite Physio for people who have that kind of back pain that seems so persistent and difficult to treat and so little improvement with the amount of exercise you're doing is 1, if we feel that whole pelvic area, buttock area around the back, in their lower back where their tailbone is and across there, we'll find that there's often very tight gluteal muscles across that pelvic rim. So right around your lower back when you feel it come around your hip. That is often very, very tight. So if you have a feel on yourself right now and you think, oh yes, that's where it's really sore, around the side of your hip, around the back where your buttock area is, always sore when you're sitting, that's the first area of muscle tightness that's often not treated correctly. And if you push and have a feel, which we often do when our patients are lying down on the treatment bed, is we get right in there and deep inside, below the layers of gluteal muscles, is your piriformis muscles, and it's really often very tight, and that's where most patients go, ooh, that is the spot of pain. That is what I feel when I sit down on a chair, and that's the spot that I can't seem to get to despite all the foam rolling. Then that really actually sometimes what you need is manual therapy to get right into there. Here at My Favourite Physio, we often use our radio shockwave therapy machine to get right deep in there to release that deep piriformis muscle. The third thing we would often find after we release those muscles is these sacroiliac joints just there. They're often really stiff, and they truly are the cause of your stiff lower back pain. So until we treat those joints and loosen that up, most people find that no matter how much exercise they do, that pain keeps coming back. Because when they're exercising, they're keeping their joints as mobile as possible. When they don't, it stiffens up very quickly because it is getting stiff with all that muscle tightness and even your ligaments that's just all inflamed and tight. So if you are out there and you've not had anyone do manual therapy, have a full fill of all those gluteal muscles, lower back muscles, deep into your piriformis muscles, and feeling your sacroiliac joints along there, that might be why your weak glutes is not actually getting any stronger, not actually helping relieve your low back pain. If that sounds like you, why don't you ring us here at My Favorite Physio? The number to ring is 02-9790-4233. And if you know somebody out there who's been foam rolling and exercising and doing all sorts of strengthening exercise, but still feel that sharp pain every time they stand up, why don't you like and share this video with them? Until next time, have a great day. Bye.